Dr. Sajid here one more time. We seem to be constantly talking about COVID, and I've been asked a number of questions about what the current situation of COVID is. So I'm going to discuss the new variant Delta, its impact on children and grown-ups, whether vaccines are effective and whether any treatment any different treatment needs to be given to children or grown-ups for this. So COVID is still around and very much around. The difference is that the virus has evolved or mutated, which means that it keeps changing. That happens in nature very commonly. And when we started with one particular type of virus, and then you have heard of the Alpha variant, which came from the UK, and then now we're talking about the Delta, which originally started from India and has spread all over. So this is a natural evolution. Let me tell you a little bit about the Delta variant, and that is that it is more contagious. That is that it passes on from one person to the other more readily. So it might, for example, the original COVID virus could infect maybe 2 people. This might infect between 4 and 8 people. So it is more contagious, and it is more what we call transmissible and passed on to others very readily. So that's one difference. The second difference is that there are some changes in the symptoms that we have been seeing in children and in grown-ups. I remember I had in my previous videos on the COVID, I had said that a dry cough and fever are generally the commonest symptoms. We are seeing more of flu-like symptoms this time, and it is with like a cold-like runny nose, cough, headache and fever. There's not so much of loss of smell and taste as we used to see before, and it is also accompanied by sore throat and body aches as before, but there is also a combination with maybe intestinal problems like loose stools and occasionally vomiting. So actually the flu-like symptoms, and if you also have diarrhea with it, you must tell your doctor. And if there has been a case in the family, then the doctor will probably test your child for COVID to make sure that this is not what is happening. Now, you are not really worried about the variant in that sense, because the symptoms are basically the same. But you must know that in many countries of the world, including Pakistan, that is the dominant strain at the present time. It is not necessarily more virulent or more serious, but it is, like I said, more contagious. So it spreads more readily. So you need to remember that, and as we discuss subsequently, what can we do? Number one, of course, a vaccine is effective, and we only give vaccine to children 18 and above, although there are some vaccines that are being given above 12 years of age in other countries, especially the American vaccines, and we are hoping that perhaps in the future that we could give the vaccine, the Chinese vaccine that is available, perhaps to children as young as 12, but not at the present time. So vaccine, when it is indicated, must be given to adults and those who are vulnerable. It does protect against the Delta variant. How much is open to debate, but it is protective, and therefore you must get the vaccine when you get a chance. And the second thing to remember is that we need to continue with the precautions. We just cannot throw caution to the wind and say, we've been vaccinated and therefore we now don't have to worry. No, you still need to wear your masks, you still need to maintain the social distance, you need also to keep washing your hands and be careful, even especially indoors, but even outdoors. So best is to prevent it, and best is to get the shots when indicated and try and prevent the disease from spreading in your family and in your neighborhood. So the Delta variant, you have been warned, is present. It is not necessarily more serious, but it is certainly more contagious. It is prevented to a large extent by the available vaccines, and we still need to take precautions as we have been advocating for quite a while. I hope this was of some use to you.